High blood pressure, or hypertension, is often called the silent killer because it can damage your body without obvious warning signs. But the truth is, your body often gives subtle clues before things get serious. Recognizing these early symptoms of hypertension can be life-saving, allowing you to seek treatment before complications like heart attack, stroke, or kidney damage occur. In this video, we will explore 7 ways your body warns you about high blood pressure before it's too late. These symptoms might be easy to overlook or attribute to other causes, but understanding them can help you act quickly. From headaches and dizziness to fatigue and vision changes, each symptom tells a story about how your cardiovascular system is coping with increased pressure. Many people assume that hypertension always causes noticeable symptoms, but that's not the case. In fact, some symptoms appear only when blood pressure reaches dangerous levels, while others may show up early and intermittently. By paying attention to these warning signs and monitoring your blood pressure regularly, you can protect your health and prevent severe consequences. Whether you're at risk for hypertension due to age, family history, lifestyle, or other factors, this video will equip you with valuable knowledge. We'll break down each symptom, clearly explain why it happens, and suggest when to see a healthcare professional. Don't wait for high blood pressure to cause irreversible damage. Learn to listen to your body and recognize the symptoms of hypertension early. Your health depends on it. 1. Persistent headaches. One of the most common yet often misunderstood symptoms of hypertension is a persistent headache. Unlike occasional headaches caused by tension or dehydration, headaches related to high blood pressure tend to be more frequent and stubborn. They usually occur in the morning and feel like a dull, constant pressure, often at the back of the head. These headaches happen because high blood pressure puts extra strain on the blood vessels in the brain. This increased pressure can cause the vessels to swell or become irritated, triggering pain. If you notice that your headaches don't go away with usual remedies and seem to come on more often, it might be a sign that your blood pressure is elevated. Importantly, hypertension headaches differ from migraines or cluster headaches in their location and nature. They are typically less sharp and more like a constant ache. While headaches alone don't confirm high blood pressure, when combined with other symptoms, they provide valuable clues. If persistent headaches are a new or worsening issue for you, especially if accompanied by dizziness or vision changes, it's wise to monitor your blood pressure and consult a healthcare professional. Early detection and management can prevent headaches from becoming a recurring problem and reduce the risk of more serious complications. Remember, headaches are your body's way of signaling distress. Don't ignore persistent or unusual head pain. It could be an early symptom of hypertension that deserves attention. 2. Dizziness and lightheadedness. Feeling dizzy or lightheaded can be unsettling, and while it can be caused by many factors, it's also a common symptom associated with high blood pressure. When your blood pressure is elevated, it can affect blood flow to the brain, leading to moments of imbalance, faintness, or a spinning sensation. This symptom often occurs when standing up quickly or after physical exertion. But in cases of hypertension, dizziness might happen more frequently or without a clear trigger. The brain relies on consistent and adequate blood flow to function properly. When blood vessels are under pressure or narrowed, this flow can be disrupted, resulting in episodes of dizziness. It's important to note that occasional dizziness isn't always a sign of hypertension, but when combined with other symptoms, such as headaches, fatigue, or blurred vision, it warrants attention. Frequent or severe dizziness can increase the risk of falls and injuries, especially in older adults. If you experience persistent dizziness or lightheadedness, especially alongside other symptoms of hypertension, it's crucial to check your blood pressure and discuss these episodes with a healthcare provider. Timely diagnosis and treatment can help restore balance and reduce the risk of complications. Listening to your body when it signals dizziness is essential. It may be more than just a fleeting feeling. It could be a warning sign of hypertension impacting your overall health. 3. Fatigue and weakness. Feeling unusually tired or weak without a clear reason is another common symptom that can indicate high blood pressure. Fatigue related to hypertension occurs because the heart has to work harder to pump blood against the increased resistance in the arteries. This extra effort can leave you feeling drained even after a good night's sleep or minimal physical activity. Unlike typical tiredness that can be resolved with rest, fatigue caused by hypertension tends to be persistent and may worsen over time. It can affect your ability to concentrate, perform daily tasks, and maintain overall energy levels. This ongoing weakness might also be a sign that hypertension is starting to affect your heart or kidneys organs that play critical roles in maintaining your body's balance. The connection between hypertension and fatigue is often overlooked because tiredness can be caused by so many factors from stress to poor nutrition. However, when fatigue occurs alongside other symptoms like headaches or dizziness, it's a clue that your blood pressure might be elevated. Addressing fatigue linked to high blood pressure involves both managing the hypertension itself and adopting healthy lifestyle habits. Regular exercise, a balanced diet, stress management, and adequate sleep can all help improve energy levels. If fatigue persists, it's important to consult a healthcare professional to rule out other underlying conditions. Recognizing fatigue as a symptom of hypertension helps you take your body's signals seriously and seek appropriate care before more severe problems develop. 4. Blurred vision. Blurred vision is a significant symptom that can be associated with high blood pressure and should never be ignored. When blood pressure is elevated, it can damage the tiny blood vessels in the eyes, leading to changes in vision. This condition, known as hypertensive retinopathy, may start subtly but can progress if blood pressure remains uncontrolled. The damage to the retinal blood vessels can cause swelling, bleeding, or blockage, all of which affect how light is processed by the eye, resulting in blurred or distorted vision. You might notice that your sight becomes fuzzy or you see spots or floaters that weren't there before. These symptoms can fluctuate, sometimes improving or worsening depending on blood pressure levels. Blurred vision can also occur during a hypertensive crisis, a severe spike in blood pressure that requires immediate medical attention. In such cases, vision changes may be sudden and accompanied by headaches, dizziness, or chest pain. If you experience blurred vision, it's important to have your blood pressure checked promptly. An eye exam by a specialist can also reveal the extent of any damage and help guide treatment. Managing high blood pressure effectively can prevent further vision loss and protect your overall eye health. Don't dismiss changes in your vision as simple eye strain or fatigue. Blurred vision can be a critical symptom of hypertension, signaling that your blood vessels are under stress and require medical attention. 5. Shortness of breath. Shortness of breath is a concerning symptom that can indicate your heart and lungs are being affected by high blood pressure. When blood pressure is elevated, the heart has to work harder to pump blood through narrowed or stiffened arteries, which can eventually lead to heart failure or other cardiovascular complications. This extra strain can make it difficult for your body to get enough oxygen, causing you to feel breathless. This symptom may start during physical activity, such as climbing stairs or exercising, but as hypertension progresses, shortness of breath can occur even at rest. It might feel like you can't take a deep breath or that you're constantly breathing harder than usual. Shortness of breath often accompanies other symptoms like fatigue, chest pain, or swelling in the legs. While shortness of breath can be caused by many different health issues, when it appears alongside other hypertension symptoms, it should raise a red flag. It suggests that your heart may be struggling to cope with the increased pressure, and prompt evaluation is necessary. If you experience unexplained shortness of breath, especially if it worsens over time or is accompanied by chest discomfort or dizziness, seek medical attention immediately. Early diagnosis and treatment can prevent further damage and improve your quality of life. Understanding that shortness of breath may be linked to high blood pressure helps you take your symptoms seriously and encourages timely care before complications develop. 6. Chest pain or tightness. Chest pain, or a feeling of tightness, is a serious symptom that can be related to high blood pressure and should never be ignored. When your blood pressure is elevated, your heart works harder to pump blood through narrowed arteries, increasing the risk of developing heart disease or experiencing a heart attack. The extra workload can cause discomfort or pain in the chest area. This chest pain may feel like pressure squeezing or heaviness and can sometimes radiate to the shoulders, arms, neck, or jaw. It might occur during physical exertion, emotional stress, or even at rest in more severe cases. Along with chest pain, you might also experience shortness of breath, sweating, nausea, or dizziness, which are signs that immediate medical attention is needed. High blood pressure contributes to the hardening and narrowing of arteries, a condition called atherosclerosis. This limits blood flow to the heart muscle and can cause chest pain known as angina. If untreated, this can lead to heart attacks or other serious cardiovascular events. If you experience any chest discomfort, especially if it's new, severe, or accompanied by other symptoms, seek medical care promptly. Early diagnosis and management of hypertension can help prevent these dangerous outcomes and protect your heart health. Recognizing chest pain as a potential symptom of high blood pressure is vital. Don't dismiss it or attribute it to less serious causes. It's your body's urgent signal to take action. 7. Nosebleeds. While nosebleeds are common and often harmless, frequent or spontaneous nosebleeds can be a warning sign of high blood pressure. Elevated blood pressure can cause the tiny blood vessels inside the nose to become fragile and prone to bleeding. These nosebleeds may occur suddenly and can be difficult to stop. Nosebleeds associated with hypertension typically happen without a clear cause such as injury or dry air. They may be more common in the morning or after physical exertion when blood pressure tends to rise naturally. If you notice that your nosebleeds are becoming more frequent, heavier, or accompanied by other symptoms like headaches or dizziness, it's important to check your blood pressure. It's worth noting that while not everyone with high blood pressure will experience nosebleeds, their presence, especially if recurrent, should not be ignored. They can be an early indicator that your blood pressure is elevated and needs to be addressed. Managing blood pressure through lifestyle changes and, if necessary, medication can reduce the frequency of nosebleeds and protect the fragile blood vessels in your nose. If nosebleeds persist or are severe, consulting a healthcare provider is essential to rule out other causes and receive appropriate treatment. In summary, nosebleeds can be one of the subtle symptoms of hypertension, signaling that your cardiovascular system may be under strain. Paying attention to this and other warning signs empowers you to take proactive steps for your health before serious problems arise. Recognizing the early symptoms of hypertension is crucial for preventing serious health complications. From persistent headaches and dizziness to chest pain and nosebleeds, these signs are your body's way of warning you before high blood pressure causes irreversible damage. By paying close attention to these symptoms and seeking timely medical advice, you empower yourself to take control of your health and reduce the risk of heart attack, stroke, and other life-threatening conditions. At Active Healthcare, Our mission is to provide you with clear, reliable information and practical advice to help you understand your body and make informed health decisions. Whether you're managing high blood pressure or aiming to prevent it, we offer guidance tailored especially for adults over 50 who want to live healthier, more active lives. If this video helped you recognize the symptoms of hypertension and inspired you to monitor your health more closely, please subscribe to Active Healthcare and click the notification bell to stay updated on our latest content. Sharing this video with your loved ones could help them catch early warning signs and seek care before it's too late. Your health is your most valuable asset. Stay vigilant, listen to your body, and partner with healthcare professionals to maintain a strong, healthy heart. Together with Active Healthcare, you can take the steps toward a longer, fuller life.